Okay, so we're going to do an endoscopic exam on this horse. He has a history of having a low-grade cough. So this is the fiber optic endoscope, very flexible, and we're going to introduce that into his nose. So it goes down the little channel, and as we're going down, we're going to look at the television camera. And easy, buddy, that's good. So what you're seeing on the TV now are the turbinate bones, and we're going down a channel called the ventral meatus into the back of his throat, and I'm just going to position it there. That's the dorsal part of his nasal pharynx, and we're going to turn the camera on to full light. There we go, and you can see at the back of the throat here we're going to look for any irregularities. So I'm going to dim the light just for a second so you can view the TV. So that's the back of the throat there. The little white slits on the side are the guttural pouch openings there. So there's the one on the horse's left. See it open when he swallowed? And then we'll look over here, and that's his right guttural pouch opening. And again, when the horse swallows, those open. So we look for any drainage of pus or discharge through those openings, and there's nothing there. So now we're going to go back a little bit to the back of the throat, and you can see his pharynx is coming down a little bit on the roof there. That's the roof of the back of his throat, and so he's got a little bit of less tone in the pharynx, and that's probably as a result of just the tranquilizer that he got. So there's a little bit of ventral displacement of the dorsal part of his pharynx. All you're seeing at the bottom there is his epiglottis, that tongue-like structure looking out at you, and you can see there are some blood vessels on top of it, and that's normal, so it doesn't look inflamed, or there doesn't seem to be anything wrong there. And so now we're going to go into his throat and have a look. Those are the arytenoid cartilages on the top, that upside down V, and you can see as he's breathing they open symmetrically, so he doesn't have any paralysis. Another thing we look at is any laryngeal paralysis. Now we'll go into his throat. He's going to cough when we do that, and then we'll have a look. There he goes, and you can see he's got some mucus, quite a lot of mucus on the bottom of his airway. That white stuff there is mucus, and he's coughing considerably, so that means he has an irritated trachea. So that gives us a diagnosis of tracheitis, and probably related to low-grade bronchitis. So I'm going to take the scope out now because that irritates him, and that's all we need to do to this horse to get a diagnosis. Good boy. Okay. Bronchitis.